Welcome to the inaugural episode of Ask a PT. We have the opportunity to talk about the hot topics in physical therapy and answer your questions. Today we're talking about the Neubie. It's a revolutionary technology that's changing the way we're thinking about treatment of acute and chronic pain and sports performance. I'm Billy Ciaffretti, the founder of Ciaffretti & Associates Physical Therapy and Wellness and the Ciaffretti Sports Performance Center. I'm a physical therapist and certified health coach. With me today is Kate Leiser. Kate is our clinical director and the director of education and training for our staff. Kate holds a doctoral degree in physical therapy, but in addition, she's a graduate of an orthopedic residency and as her orthopedic certification specialist. Welcome, Kate.
Thanks, Bill.
So I want to remind you and the audience, it was about a little over a year ago that I said, Kate, there's some new stuff out there. I think we need to check this stuff out. So I want you to come down to Florida with me to take a look at this thing and see if it's, if it's really real and how good is it.
Yeah, and actually, when you first said that to me, I thought you were a crazy person because how are we going to take our time out of the clinic to go for a couple of days to Florida? And I wasn't really a believer in the technology. I didn't really think that it was going to be worth something investing in our time. And boy, was I wrong.
Yeah, well, we're both on the same page with that because our program is really centered around really the application of thoughtful evaluation, hands-on performance, and the development of a great treatment regime, and not so much the technology. So we were both really surprised. So tell the audience, what is Neubie and what is it?
So Neubie stands for neurobioelectrical stimulation. It comes from the company Neufit. It's a type of electrical stim machine. It's different than the electric stim machines we've had in the past in the clinic that most people are familiar with, like a TENS unit, for example, or something that's commonly known as Russian stim, which we use to kind of get the muscles firing. The Neubie works on a different type of current, so it's a direct current system versus an alternating system. And really what it does is it impacts your nervous system in a very profound way. So instead of getting sort of this temporary disruption of information that you might get with a TENS unit to give you some temporary relief of pain, the Neubie really has a lasting effect on your nervous system. So instead of being a system disruptor, it really is a system changer.
Oh, that's great. It really works quite differently than anything else we've had that way. Can you tell us a little bit about pain and how pain operates and how this actually interfaces with pain?
So under normal circumstances, what happens if you do something like you step on a nail, you step on the nail and that information from the environment, the nail going into your foot, for example, that information travels up to the brain and then the brain sends out the message that says, ow, essentially. So pain is really a response to the environmental stimulus or the environmental input. And it's just your brain's message, which is a protective message. It tells us not to do that because, ow. So what the Neubie does is the Neubie helps to change some of the input information. So it uses the sensory system. So it gives you a bunch of sensory information from the painful area up to the brain. But because it's flooding you with more sensory information, the brain changes the output. So that may be decrease in pain, less of a protective response, so usually more range of motion and even improved strength right off the bat.
Yeah, that's terrific. So it's really the change of the input resulting in a change of the output for the brain as it relates to pain.
Yeah, and that's really different from a TENS unit that we've used traditionally in the clinic and a lot of people are familiar with. That really is just disrupting the signal as it's coming down from the brain more than anything. And that's just a temporary disruptor. It's like you just put a little roadblock in there for a time period, but then that goes away when it's turned off. The Neubie has a more lasting effect.
Right. Well, that's one of the real exciting parts of it is it's not for a temporary relief of symptoms at all. It's very long-term changes. Can you tell us a little bit about the application of it and how, some of the applications maybe in acute pain, chronic pain?
Yeah, so we're really using it for a wide variety of problems and diagnoses. So We're using it with people with acute pain problems. So if someone comes in and they say, oh, I tweaked my back or I pulled my hamstring or whatever the condition may be, we're using it for acute injuries, but also for more chronic things, people who've had pain for a really long time. I mean, we've had people who've actually come in and they've had pain for years. And in 1 to 4 sessions, we've had a really strong impact on that pain. And even neuropathic pain that's existed because someone had some kind of nerve irritation somewhere in their leg or in their arm, for instance. And we're seeing changes that are long lasting with that too. And these people that traditionally have been really tough, it's been really hard for them to get control of their pain and move forward. We're also using it with people with a variety of nervous system disorders. So we're using it with folks who have spinal cord injuries and folks who have muscular sclerosis. And we're seeing these people who normally would be experiencing a deterioration in function, they're seeing improvements. They're seeing improvements in strength. They're seeing that they're having less falls. Their balance is improved. And it's beyond what we would normally expect from a course of physical therapy. It's definitely faster.
That is really exciting. That's really exciting for us in our clinic, but it's really exciting from the whole thought process of our profession and how that's really changing things. It certainly is changing the way that we're thinking about how we approach things here. And it adds on to our foundation, what we've always done. So, I see you out there with folks, and sometimes, you are like going around the gym or you're doing these other kind of things. Can you tell us a little bit about how this thing works differently in the sense of using motion with this?
Yeah, so this is really cool. And this is where the lasting change comes in, because we're really retraining the nervous system and retraining the brain. So, for example, if someone comes in and they say, oh, my hip really hurts, we can actually use the Neubie to map out that area. And the patient will feel places where the sensation is a little bit different. And those are areas where the brain's not really registering what's going on quite as clearly. And we can direct the treatment to that area. So once we've mapped out that area, we find 2 areas where the communication is a little bit off in the system. We put pads on those areas. And then instead of just having you lie on a table for 10 or 15 minutes with the machine on, which is the traditional way to use an electrical stim, like a TENS right, or an interferential e-stim setup, we'll actually have the person move. So we'll come up with a series of movements that would be beneficial for the condition. And as they perform those movements, we turn up the signal on the Neubie so it becomes more intense. And that helps to facilitate better adaptation within the system. So even in someone, for example, we see a lot of folks after a knee replacement. Knee replacements traditionally are very painful. On the rehab side of things, early on in the post-op care, people come in, they're limping, it's really uncomfortable for them to get their normal gait pattern. We've had people, they come in on their first visit and we're mapping that area and they're walking back and forth in the gym and they're saying, hey, I haven't felt this good I haven't felt this good in years. My knee felt terrible before the replacement. I've been really sore. So it helps to get them to kick things along a lot faster.
Well, that's great. So actually the machine not only does it deliver the care, but you mentioned about mapping. So the mapping is actually something that is used to actually locate where some of the dysfunction is, and it may not even be necessarily where the pain intensity is felt by the individual. Is that right?
Yeah, absolutely. So we know based on all of the time we've spent with the Neubie that I can pick some spots that I think would be good spots, but it's not a good idea. I need to just let the Neubie and the patient figure out where those areas are. That is the most effective. And we see that across the board with these conditions, whether it's a pain condition or it's something more of a nervous system condition like muscular sclerosis, which is hugely involved. Just letting the Neubie do the work and the patient, it's great. It's very effective that way.
It's really been fun to see some of the people out there moving and doing these kind of movements with the equipment on. So that's really, it's been fun, and see the smiles on their faces. Now, there's something on here called a master reset as another aspect of what we can use with that. Can you speak to what that element is and how that interfaces with the nervous system?
Yeah, the master reset is really a very cool setting, and this is more of a relaxation setting to sort of reset the nervous system in a different way. So, especially in the last year with COVID, people working from home, people are teaching their kids at home who have no background in teaching. Our overall stress levels are up in general. And what that creates is a little bit of a disconnect in our nervous system where you've got these two parts of your autonomic nervous system. So you've got your fight or flight. So there's a bear chasing me, run like heck. And then you've got this rest and digest phase which is more of our recovery phase. In times of really high stress, we start to go more toward overall that more sympathetic, more fight or flight side of things. And that can be hard to get that back down. And that has a direct influence actually on pain. It can also impair your sleep. It inhibits your gut function and can have a variety of effects on the rest of your body. So what we can do with the Neubie is this master reset, which actually we put pads up here on the neck and then pads on the bottom of the feet. We get it to just a comfortable level where the person feels the buzz, but the muscles are nice and relaxed. And they spend some time doing some deep breathing in a quiet room, and they just stay on the machine for about 15 or 20 minutes. What we're seeing with that is it really helps to bring people back to this more rest and digest kind of recovery phase and balance out the system. So some people come in with it where they have a lot of pain. We can't always necessarily do something right off the bat. If we do a master reset first, that helps calm the system, and then we can work from there. So it's really helpful in that way to just kind of get things to calm down. And we know that it really does have some strong effects on the autonomic nervous system because we can see that in some of the data that's coming out from other practitioners, tracking things like heart rate variability, which gives us a good indication of autonomic nervous system function.
Great. So I want to ask you more about the sports performance side of things, but since you mentioned about the master reset and the recovery, does that play a role in the sports performance parts of things? Before we actually talk a little bit about how does this thing work with sports performance and strength and flexibility?
Yeah, I mean, really everyone and anyone can benefit from the master reset, especially, we talk about things sometimes in PT about having sort of this stress bucket. We all have a stress bucket, and you can think of it almost more like a watering can. So it has a fountain, that spout coming out the front. And we have all these different stresses throughout the day, whether it's physical stress or emotional stress, psychological stress, whatever that may be. Our bodies don't recognize the different types of stress, but stress is stress. And as that stress bucket fills up, it gets more and more full until you get to that tipping point where the stress starts to come out that spout. So what the Neubie can do is can help bring the overall system level down. So it may be the physical stress of overtraining or being in a really hard training program for some of our athletes.
Right.
It may be more of the life stress that some of us feel. It may be pain-related stress. It may be all of those things. So we can use the Neubie to kind of bring things back down. When you get the system to calm down, it functions at a higher level overall, so then you can move forward again. So that does mean better performance, whether it's sports performance, performance at work, ability to focus, even gut performance. We've had reports from people of all of those things improving.
Excellent. That's cool. So we've talked especially about the pain elements because that's usually what people come to see us for. But as far as the nuances about sports performance, what does this do as far as strength things that's really different than other stuff that we've done?
The Neubie is fantastic for creating really good muscle hypertrophy and strength gains in a really small window of time comparatively. So normally, if we want to make real strength gains, you've got to be working and exercising and overloading and really loading the muscles a lot to create enough change for the body to adapt. And that takes a long time. That takes months. That's not something that happens overnight. Right. So true strength gains take a long time. With the Neubie, we can actually set up the Neubie on the muscles, and it helps the body to recruit the most motor units, we call them motor units within the muscles, to perform that movement. So under normal circumstances, because our bodies are so efficient, we recruit the minimal amount of motor units when we do something, because that's an energy savings too. With the Neubie attached to the muscle, we can stimulate the motor units so you recruit more. So you make faster gains and oftentimes a really nominal amount of reps. It also means that if someone is recovering from some sort of injury and going into a strength phase, maybe they've had a chronic tendonitis or something like that,
Right.
they're able to do some higher load strengthening without getting too much stress on the tendons and on the muscles, because they can make these big gains without much weight, without much resistance.
Terrific. So that actually puts us in an area where we can use this as the connector from initial rehab, and when we're transitioning into the return to sports stuff, it gives us that connection with that.
Yeah.
That's terrific. Great. Is there any contraindications, things that we need to be aware of with this?
Absolutely. I mean, you're not going to, just like any other type of electrical stim, you're not going to put it on someone who has some kind of impairment in their electrical function in their heart. If they have a pacemaker, those are all things that need to be discussed with the person's cardiologist to get their take as to whether it's something that's safe or not. We're not using it also on pregnant women. It is contraindicated for that, just because it has such a strong effect on the autonomic nervous system. You don't want to end up creating some kind of a problem. But it's actually, there are really not very many contraindications. One of the really great things about this type of unit with the direct current and the frequencies that are being used is people, they don't get electrical burns. You can turn the machine up as high as you want and it's really safe. Whereas a regular, even a TENS unit, there's some risk of electrical burn if you get it up to a high intensity or the pad isn't sticking well. These machines are really safe. So it's a great confidence booster for people to know that, yeah, I can really turn this machine up and it's uncomfortable while I'm doing it, but it's perfectly safe for me.
Yeah, that's a great benefit for the patient. It's also a great benefit for us as clinicians, really understanding that we've got that level of safety with it. Terrific. Is there anything else that you want to add that you think we should bring up, or if there's any questions, we're really happy to speak to those.
Matt, do we have any questions popping up today?
No questions today from the peanut gallery.
I mean, really, the big thing with the Neubie is it really can help a lot of people, and it doesn't take the place of traditional physical therapy. We still have all of our regular tools in our toolboxes, but it really accelerates the rehab, the recovery process, the performance process, like the strengthening. It really accelerates those things. So it makes the process overall faster and certainly more comfortable for people from a pain standpoint. We've really seen tremendous results with the Neubie, and in my opinion, it's a game changer. It's the only thing that's come along in the time that I've been practicing that is outside of some kind of skill set we develop as physical therapists. It's a tool, a true tool, that I think is really, really valuable. It really creates a great experience for the patient, and as a clinician, I can see the difference.
That's great. Well, I know you've been around a while, and I have more gray hair. In fact, I have gray hair. You don't. And
I got a couple.
I've felt the same way, that this is the first thing that's really been a game changer in our profession. But it's a tool that seems to be really beneficial for people that have a solid background as a clinician to begin with, and you use this as a tool.
Absolutely.
Well, great. It's been terrific to have you here today, Kate. I hope this has been of interest to the public, and we'll be happy to answer any questions if people have an opportunity to write in. So thank you.
Thanks a lot.